Now let us try to understand the meaning of exposure therapy. You all are aware what is psychological therapy, what is behavioral therapy, right? I think you all must be doing this course and learning about so many therapies. Now exposure therapy is one of them. Okay. Now what is exposure therapy? The name itself is giving the hint. We are going to expose that particular stimuli to that person in order to what? In order to get rid of that unwanted situation. Right? Exposure therapy is a psychological therapy that was developed to help people to confront their fears. Right? It was developed in order to what? हम उसको directly we are going to let the person face that particular fear without giving any harm. We are going to correct that unwanted thought process of that person with the help of this therapy, right? Exposure therapy is a technique in behavioral therapy to treat anxiety disorder. Exposure therapy involves exposing the target patient to the anxiety source or its context without intention to cause any danger. The last line is very much important to be noted down, that it's context without the intention to cause any danger. We are going to confront that person with a particular fear, but our intention is not to give harm, but in order to correct that thought process, in order to get rid of that particular fear from the mind of that person. Okay. Now, what? Exposure therapy can be scientifically demonstrated to be helpful treatment or treatment component for a range of problems, including what? Panic disorder, social anxiety disorder, obsessive-compulsive disorder, post-traumatic stress disorder, generalized anxiety disorder. This disorder which I've mentioned here, see, there are lots of percentage increasing day by day. Like it was only 40 to 50% last 5 years back, but nowadays exposure therapy is very much helpful in treating such kind of disorder, and the level has increased from 60 to 90%. Okay, so can anyone define what is panic disorder? Panic disorder आखिर होता क्या है? Because according to this disorder, I am going to share some case studies. Okay, and how we as a therapist have conducted the exposure therapy and how successful it was. Okay, so first let us try to understand the word panic disorder. Panic disorder hota kya hai? Can anyone define in a very easy in a very easy way? Panic disorder, any kind of this one signs or symptoms you can find in a panic disorder patient. कोई बता सकते हैं पैनिक डिसऑर्डर में क्या क्या होता है, क्या प्रॉब्लम होती है? And one question, is it okay if I'm mixing Hindi with English, or shall I start the lecture only in English?
No, ma'am, Hindi and English are more comfortable for me, especially. So you can.
I can add. Yeah. That's why I was asking, because some students were asking me. That's why. Yes, panic disorder में क्या होता है? Any sign and symptoms? Yes, Ritika, can you define? And Jasmine, you can also say.
Anxiety.
Panic disorder, yeah. Anxiety.
Yeah.
Ma'am, persistent worry or changes in the behavior that basically leads to the situation or state of panic.
Even sweating, I guess, heartbeat start increase if you are in a panic disorder. Also, sometimes you can see you get panic if you're close one, you can see a death or attack. I mean, any road accident, which is similar to your experience. Then also you get start panic disorder, not even attack. Sorry.
I mean, ma'am, there is no physical disorder. There is no physical issue, but still it kind of affects. It gives that feeling that we have.
Yes. I meant that. Sorry.
Sudden feeling of danger, and you feel that we are not in control of that situation. In that case, it is a panic disorder.
You're muted, ma'am.
Yeah. In panic disorder, there is excessive and persistent anxiety. The feeling of excessive anxiously, the person used to what? Execute. Okay. Panic disorder में जो person होता है उसमें क्या होता है कि persistent, it is persistent. It's not like you have seen a very scary movie or something, a very unwanted situation and you get frightened. It's not in panic disorder. In panic or disorder there is persistent, and what? It can be harmful because it can cause panic attack in the crowd also, in some uncomfortable zone also. Like for example, a person is having panic disorder when he's having some crowd phobia, and when what happened, suddenly panic attack occurs, and it is very harmful for that particular person also, and the person whom he has been escorted, right? जो साथ में चल रहे हैं उसके लिए भी दिक्कत है जब किसी को पैनिक डिसऑर्डर हो जाता है, and the patient himself. So it is very important to identify the source and get it treated.